Over 4 million people around the world have Parkinson's disease, and around 120,000 of them live in the UK. So whether you've been recently diagnosed with Parkinson's or you're close to someone who has, the first thing to know is that you're not alone. We know that there must be 101 questions running through your head, so we've produced this DVD to try and answer some of them. Perhaps you'd like to know more about the condition, or you may be worried about how it's going to affect your relationship, your family, or your job. Perhaps you want to know more about the medication and side effects, or what activities you can still enjoy. In this DVD, you'll meet a whole range of people living and coping with Parkinson's, who'll explain what life is like for them and tell you about the things they get up to, which incidentally is a lot more than you might expect. You'll also hear from consultants and specialists, physiotherapists, speech therapists and other healthcare professionals who'll explain what Parkinson's is, what the symptoms are, what treatments are available and how effective they are. You can watch the whole DVD or skip through to the chapters that interest you. The important thing to remember is that there's a whole world of support for you. Medical support, practical help and perhaps most importantly, a lot of emotional support and practical advice from people who already have the condition or are looking after people with Parkinson's. Many of the people you'll be hearing from in this short film are members of the Parkinson's Disease Society. They'll be talking about a range of issues, including what being a member of the society means to them. We'll also be taking a more detailed look at the lives of two people with Parkinson's. There's Nina Temple, who's had Parkinson's for a number of years. She broke the news to her friends in the most surprising way and went on to form the Sing for Joy choir. You'll find out why that's so important to her and why you might find it beneficial too. And we talked to Robert Taylor, who runs an art class in South London, and we'll see how he's using his art as a way of helping other people with Parkinson's.
Psychologically, I was expecting something, so I was prepared really for something. I had a suspicion that it was probably going to be something like Parkinson's, so perhaps I was psychologically prepared, and I had a lot of support around me. My family were very good, so I coped reasonably well, I think.
I couldn't believe it. I was 46 and it just seemed incongruous with everything I'd achieved and everything I was hoping to achieve in my life. So I was in denial and frustrated, like most people get, and so I resolved that I wouldn't let it permeate my life, really. I tried to not live the Parkinson life, and that was a conscious decision. I just thought, well, I'll just lead my life, and that's exactly what I've done, really.
I've tried to ignore it, I think, really. I had a very difficult time when it first came out. Had a bit of counselling and decided I was going to get on with life. Went back to work, became a member of the Parkinson's Society locally. So between working a bit, the family at home, golf and work, it's quite a busy life. And I found that to be invaluable in keeping things away.
Well, when I was first diagnosed, I suppose I felt relief, really, because I had imagined that it could have been a lot worse. And I was very reassured by the way I was told about the condition, because I was told that it could be, I would get help with the management of it. Not a cure, but it could be managed, and that gave me a lot of reassurance.
When I was first diagnosed, I was worried my working life would be affected. I was worried whether I'd be able to get to work and how long I'd be able to drive for, whether I'd be able to carry on working for any length of time, and really just what the future held.
When I was diagnosed, which was I think in about 1999-2000, I'm very concerned about my job, because I just got married, and later in life obviously, and we had a big mortgage, and I was very concerned about if I had to give up work, whether we could afford to keep the house.
I think the main thing is to try and, when you're newly diagnosed, is to try and keep as positive as possible and to keep going and to keep trying to do all the things you're used to doing and don't give in to it, basically. We haven't.
As you can see, there's no typical person with Parkinson's. The condition affects everyone differently. But what exactly is Parkinson's disease? Parkinson's is a progressive neurological condition affecting movements, such as walking, talking and writing. The important word here is progressive. Parkinson's is not a terminal disease. Our doctors will explain more about the difference shortly and also how Parkinson's is diagnosed. Can Parkinson's be inherited? It's understandably a big worry for a lot of people. You may be concerned that your children will inherit the condition. But in fact, it's estimated that only 5% of Parkinson's has a genetic cause. There is no genetic testing for Parkinson's at the moment, and the chances are so low that testing could cause more harm than good with unnecessary alarm. The fact is that doctors still don't know the exact cause of Parkinson's disease. Genetics may play a part, but it seems more likely that a combination of genes and something in the environment is a cause.
Parkinson's disease is a chronic, progressive condition which we call a neurodegenerative condition, which means some of the nerve cells which carry a chemical called dopamine in the midbrain, which is an area of the brain, seem to degenerate and slowly die at a rate that is faster than normal aging process. This problem with the dopamine system and perhaps some other chemicals in the brain leads to expression of problems such as stiffness, difficulty with mobility, sometimes shaking, tremors, and collectively that's what we call as Parkinson's disease.
Patients get quite worried when they're first diagnosed with Parkinson's disease and ask us whether the condition is progressive and even whether it's terminal. Obviously these are quite emotive terms, and particularly terminal. That implies cancer, implies death within a year or two. Now, Parkinson's disease is not terminal in that sense. Patients will remain physically active with a very good quality of life with current medication and rarely surgery. Parkinson's disease is usually quite easy to diagnose, but clinically. It depends on the person seeing the patient having enough experience of diagnosing Parkinson's disease. This is why we now suggest that everybody sees an expert, either a neurologist or geriatrician with a particular interest in Parkinson's disease. And they will examine the patient on a couch, having taken the history, perhaps watch them walk, and probably in the region of about 90% of cases, one can be clinically sure from that examination that the patient has Parkinson's disease. In that other small percentage that we're left with, it may be that we need to do other tests, such as an ordinary scan, an MRI scan of the brain, to see if there's any other potential cause of their symptoms. And very rarely, again, we might need to do one of the new SPECT scans, or a DAT scan. But I do very few of those, only 5 or 6 a year at the most. So not everybody needs a scan. In fact, it's probably more in the region of 2 to 3% need any form of scans. We're now finding some genetic forms of Parkinson's disease, but they are still extremely rare. They're very important because they're giving us clues to what causes Parkinson's disease, and that may lead to more treatments for everybody with Parkinson's disease. But they're still vanishingly rare. To put this in context, it's probably only about 5% of cases of people with Parkinson's disease in the UK who have any genetic form of the condition. At the moment, we don't know what causes Parkinson's disease in the vast majority of cases. There's a lot of evidence that it may be due to something in the environment. There's some evidence coming through that in a small proportion of cases it may have some genetic predisposition, but it's probably some combination of something in the environment with a genetic predisposition. But that's really as much as we know about what causes Parkinson's disease at present.
But what are the symptoms of Parkinson's, and how will the condition progress? If you ask most people, they probably tell you it starts with a tremor. But in fact, almost a third of people with Parkinson's never develop a tremor. They may experience stiffness of the joints. A frozen shoulder is a very common first sign. And there are other signs, like a lack of sense of smell, difficulties with handwriting or turning over in bed, disturbed sleep, an urgent need to go to the loo. Some people say they feel they've slowed down and lack a full range of movements. For example, they notice they don't swing both their arms when they're walking. There are other mental health issues too, which can be symptomatic of Parkinson's, like deteriorating concentration. But just as there's no one typical person with Parkinson's, there's no one set of symptoms. As we heard earlier, Parkinson's is a progressive condition, so things do change. But for most people, they change very slowly.
The first symptom of Parkinson's disease for most people is a rest tremor. So this is an involuntary rhythmical movement up and down of the fingers of one hand when the patient's at rest, so lying in bed at night or maybe when walking along with the arm at rest by the side. Later on, things get a little bit worse with some stiffness of the arm and difficulty using the hand, so that they may have problems with writing, so the writing may become rather small and spidery. The stiffness can be significantly severe, so that it involves the shoulder, and so the shoulder can freeze up and be quite painful, so-called frozen shoulder, which may need specific treatment with injections and physiotherapy.
In Parkinson's disease, not everybody gets a tremor. Figures would suggest that 25 to 30% of people with Parkinson's may actually not have a tremor, certainly when the condition is diagnosed. This is important to recognize because, of course, this might lead to misdiagnosis if people rely on tremor for the diagnosis of the condition. Well, as our knowledge about the symptoms of Parkinson's has developed, it's become clear that along with the motor syndrome of Parkinson's, which involves the tremor, the stiffness, the difficulty with writing, etc., comes the non-motor symptoms of Parkinson's. And these can be wide-ranging. They can vary from problems with bowel and bladder to severe problems with sleep, difficulty in turning in bed sometimes, getting up at night to pass urine, to memory problems, concentration problems, etc. A fascinating area of non-motor problems in Parkinson's perhaps is difficulty with the sense of smell, and sometimes people develop abnormal movements during deep sleep, even causing self-injury or falling out of bed, etc., a feature we now call REM behavior disorder. The mental health problems in Parkinson's can be very variable. Some people might develop an anxiety related problems. Some people might develop depression, which can be major or minor. And some people might develop frank dementia. That tends to happen more in the advanced stage of the disease. And smaller problems might be related to the mental health problems, might be its effect on sleep, for instance. And also some people might have problems such as difficulty with simple day-to-day activity, mainly memory, short-term memory.
Parkinson's disease is very different for different people. There are some people who develop it when they're a little bit older, maybe in their late 60s or 70s, and they can have a particularly tremor-dominant form of the condition, and it can be very slowly progressive over many years. Similarly, people who have younger onset Parkinson's disease, that too can be very slow to progress.
Parkinson's disease is a progressive disease, and the rate of progression is extremely variable. So when you're first diagnosed, it's not really possible to say what you'll be like in 5 years' time. Some progress rapidly, others progress slowly, but we can always manage the condition from the very beginning and make the symptoms as tolerable as possible for you. So it is progressive, but the progression can take a long time. Currently, because we don't really understand the cause of Parkinson's disease, we can't say we have a cure. But that doesn't mean to say that it's hopeless, because we understand such a lot about what matters, what happens in the brain, that we have superb ways of controlling with medication and also providing a support system with Parkinson's disease specialists, consultants, and so on, to make the life of a newly diagnosed person very tolerable. It's obviously a shock to be diagnosed, but it can be managed very well for quite a long time so that you can virtually lead a normal life.
There is currently no cure for Parkinson's, but there are a variety of ways to manage the condition. Drug treatments, therapies, and in some cases, surgery. Parkinson's is caused by a decrease in the levels of the chemical dopamine in a part of the brain that's responsible for the coordination of movement. The current drug treatments aim to either increase the levels of dopamine within the brain in order to stimulate the parts of the brain where it works to mimic its actions, or to block the action of other agents within the brain that break down dopamine. There are a variety of drugs that can be prescribed. Because no two people with Parkinson's are exactly the same, and each will have a different combination of symptoms, their drug regimens will be different too. And so will the side effects. Medication is extremely effective at relieving the symptoms, but one side effect you may have read about in the media is called dopamine dysregulation syndrome. This affects about 3% of all people with Parkinson's, most of whom are under the age of 50, and can lead to feelings of euphoria, aggressive outbursts, compulsive gambling, and even hypersexuality. Even so, once the side effects have been recognised, this can be managed. So please tell your GP or consultant.
Everybody with Parkinson's disease should be referred now to a specialist who's got a particular interest in Parkinson's disease. And we would advise people either to go to see a local neurologist or geriatrician, but someone who has a particular interest in Parkinson's disease, somebody who's running a regular Parkinson's disease clinic and possibly has a nurse to support them in that clinic. The issue about when a patient starts medication is very much left up to the patient. It's a case of when the condition is interfering with their quality of life, when it's stopping them from doing things. Not so much when the tremor is, say, an embarrassment, but when the slowness in the main arm that's affected is causing them problems with everyday living. At that stage, I think most neurologists or geriatricians would suggest that they commence treatment.
The timing of medication in a person with Parkinson's is very important. And while we try to, as clinicians or healthcare professionals, try to give a fixed pattern of drug dosing, often the patients are the best judge of when they need tablets or their medications. So one does not need to be too didactic about the timing, but whatever timing it suits them, it's very important that they get it at that time. And this is why it's so important that hospital staff, should such a person be admitted to hospital, be aware of this problem and this issue, that the patient should be given the drugs at his or her prescribed timings.
Some of the benefits for people with Parkinson's in terms of physiotherapy would be that they can keep their activity levels going. Very often people will think that they have to stop exercise when they've been diagnosed, and it's really important to maintain some activity. And a physiotherapist can actually give you advice on the right sort of activity, on particular exercises if there's some joint stiffness or pain. It's really about, she can give you advice on maintaining your normal activities of daily living. Somebody who's been newly diagnosed with Parkinson's disease really should try to find a physiotherapist as soon as possible, because the earlier you can get advice and support, the better. You can have advice, particularly in the early stages, for maintaining your posture and maintaining your exercise levels. And then as problems might arise, you can have advice as quickly as possible.
A physiotherapist can really help you maintain your range of movements. But there are all sorts of other therapies out there that can help. For example, a common problem is finding it difficult to articulate your words or having a weaker voice. And that's where a speech and language therapist can really help.
My role as a speech and language therapist is is to help people who've got communication difficulties arising from Parkinson's disease. And the main thing that we usually have to concentrate on is getting a loud enough voice, because it's often a quiet voice that people first present with when they get a diagnosis of Parkinson's disease. They might also have difficulty with articulation, saying the sounds that are required for speech, and also possibly with the intonation patterns, such as getting the right melody in their speech, the right stress patterns, the right pitch, and some people also develop difficulties with their swallowing, so we can help in that area as well. There's also physiotherapy and occupational therapy, and they all help to maintain independence, keeping people active, healthy body, and keeping people able to do as much as they want to and improving their quality of life.
Other people find that certain kinds of complementary therapies work for them and improve their sense of well-being. There are a huge number to choose from. It's simply a question of finding something that works for you.
The medication that I receive is a big help, but on its own is not sufficient. I have had to play my part. So there's a partnership between medication controlling my Parkinson's and myself controlling my Parkinson's by understanding what it means to my body and how my body works.
I've found since I've been going to the gym that I'm much better. I notice if I don't go to the gym, I stiffen up quite a bit more.
I was always quite fit, and I've kept everything up. In fact, I did yoga as well, and I still go to over 50s Keep Fit classes, and I play an odd game of over 50s badminton, and I go to yoga, and I'm sure this has helped me.
So you can see that different people find different therapies to suit them. Nina Temple certainly found a unique way of enjoying a therapy that really worked for her.
My name's Nina Temple. I was diagnosed in February 2001, and I got my first symptoms back in '99. I was feeling quite unwell with something that I didn't know what it was for quite a long time, and I think I tried to avoid finding out what it was, and I gradually began to realise it was probably something quite serious. But by the time I got to the hospital and saw the consultant and was diagnosed with Parkinson's, my feelings were mixed. It was good to know what the problem was, but on the other hand, the way the diagnosis came over was a bit of a bombshell, to say the least, and I felt there was very little support at the time. So I suppose I felt like the ground had been taken away from under me. To start with, after diagnosis, I was really just retreating from the world and trying to avoid people seeing me shaking, trying to pretend that it wasn't really happening. And I hadn't really thought about how I was going to get on with my life or anything like that. I think really I just needed time to grieve for what was not going to happen in my life, all the things that I'd taken for granted that had gone. But then I decided that really if I just sort of stay under the duvet, the only person that will suffer would be me, because I'd miss out on lots of things in life that I didn't really need to miss out on, because I wasn't actually that ill when I was first diagnosed. So I decided I had to tell everybody and get it out of the way. And in the end, I thought the easiest way to do that would be to have a Parkinson's party and just tell everybody that I knew and invite them all to a really good party, which is what I did. It was quite emotional. I gave a little speech about the illness and what it had meant for my life and how important it was to have my friends around me and everything. And there wasn't really a dry eye in the house, but it was a great party, and I felt a lot of support and love coming from it, so it was a nice thing to have done. I'm working part-time now. It's okay. I find it difficult at times when I have to go to sort of posh places and meet lots of new people. I'm still quite, sometimes quite reticent at just sort of going into a room with a lot of strangers and saying, oh, by the way, I've got Parkinson's, although I'm getting more used to doing it. The actual job I enjoy working with my colleagues, and I find it possible to do because I've got the voice recognition support, which I got from the Access to Work scheme. I was quite reticent to start with, to ask other people for help with things that I find difficult to do. But as I've got more used to the disease and become more confident about saying, you know, I've got this disease, I can still do useful things in my work, but there's certain things I need help with, then people have got more comfortable with giving me the help that I need. My daughter's very supportive. She's very interested in sort of health issues, so she's found out quite a lot about it. And my son's very kind in sort of little quiet ways to just sort of get things that I need without making a fuss, so it's very nice. And my husband's just been fantastic, so I feel very lucky, really. I think in lots of ways it's made me a lot closer to the people that I know, so although I wouldn't have chosen the disease, there's definitely good things that come to your life when you deal with something like this. Well, I didn't find it helpful at the beginning for people to sort of say, pull yourself together, you know, show a brave face and things like that, which some of the health service people tended to do rather a lot, I found. So I would say, give yourself time, but also you get to a sort of point where you start to want to rebuild and you start to realise that, okay, there's certain things you might not be able to do, but there's lots of things in life that you can still take an interest in and make time to do. One of the first things that I took an interest in was singing. I went off for a little holiday to sort of build up my morale, and there was singing every morning there, which I found very pleasurable. So when the Parkinson's Disease Society set up a scheme to give out grants for people to do anything they'd ever wanted to do, I applied to set up a local choir, which has been going ever since and has given me and a lot of other people a great deal of pleasure. I just think anything that gives you the chance to sort of be creative, be with other people, and just give time for pleasure and joy, really, rather than feeling kind of under pressure all the time, is very important. I mean, the singing was doubly beneficial, really, because obviously it gives a lot of pleasure and it's great fun, and you see people sort of smiling away and singing their hearts out, and we're all very sort of happy and energised at the end of the session.
They crowded the floor. Wish I could go there without you. Don't get around much anymore.
But it also has quite a direct therapeutic benefit as well. And in fact, we got our choir leader to go and meet a speech therapist and learn some exercises that we do as a warm-up every week to help to keep the volume in our voices and so on. So it's important in that sense as well.
Couldn't stop my hand shaking. Don't get around much anymore.
Quite an interesting group, actually, because we set it up, me and another woman with Parkinson's, and our husbands helped us to set it up. And we sort of thought from the beginning it would be nice to have a mixed group of people with Parkinson's and people who were just friends and neighbours and in the community. But because it was set up by people with Parkinson's, it feels very much like a safe space and a place in which we're sort of active partners rather than just a place where we're done good to, in a sense. So I think my message, I suppose, would be do take time to sort of let it sink in, but don't feel that it's the end of your life. In some ways it can be the beginning of a new journey.
Don't get around much anymore.
The moment you're diagnosed with Parkinson's, it can seem as though your life has changed forever. The question is, by how much? You may be anxious about work. There may be financial consequences if you have to stop working. Will you still be able to carry on with your day-to-day life? Again, it's different for everyone, but with the right support and encouragement, you'll be surprised by what you can still achieve. Of course, it's not just the person with Parkinson's who's affected. If you're a partner, you may be worried about your new role as a carer. You're going to have to take on a whole new set of responsibilities and learn a whole new routine. Parkinson's isn't something that's just going to go away if you ignore it. But with a positive outlook, it is possible to lead a full and rewarding life.
The drugs that you can have now, in the last 10 years, the drug cultures has dramatically improved so that one can lead a pretty normal life for an awful long time. And even at 15 years, the pills get me up in the morning and I still have a very full life.
If somebody's newly diagnosed, I would tell them not to look at other people too much and think that they're necessarily going to be as other people are, that everybody's different and you really can't tell how your pattern is going to be. So you just need to just go along with how you are day by day, not to look too far ahead.
Don't give anything up that you already do, and find out as much as you can about the medication as possible so that you understand what everything is going to do.
It's not an instant killer. You're going to live for a long and happy life if you let yourself live for a long and happy life.
You've got a condition that can be managed, that there's lots of support out there as and when you need it. And we're all individual in the way that the condition presents in our reaction to the medication. And there's a lot of hope out there.
I was diagnosed nearly 8 years ago, and a lot of people I knew at work knew I was having problems with my tremor. And so I had to tell them all what had happened, you know, and I remember saying, I hope this isn't going to make any difference to how you feel about me or how you think I'm able to do the work or not. And everybody said that's fine, but I was very, very worried at the time. As time went on, I did feel I had a lot of support, and of course at the beginning the symptoms are not so bad. I did feel very, very tired, but I was able to do the work. As time has gone on, then different things have come about. So, for example, starting tablets made me feel very sick, so I had to cope with that. And then now I feel that I don't remember things so well, and I need to have change of job. But all of that has been looked after, if you like, so you know, I have carried on working.
Well, straight away I talked to my manager and my supervisor, and I told them the situation, that I'd been diagnosed with Parkinson's disease. They were very good. They looked it up and found out all about it, and they have been very good to me, very supportive, so I've been very lucky.
I consciously took on a totally different career change at 60, which people said was impossible for me, but I managed to do it. And I finished up working for the Department for Work and Pensions, which I thought was rather appropriate.
No, I've tried to keep my social life since being diagnosed with Parkinson's much the same. I've kept my friends. I've found more friends through my links with the Society, made a lot of good friends through my links with the Society. So I think overall I've benefited from having Parkinson's. There's been many blessings that I've received as a result of Parkinson's, and that I would have been deprived of had I not have been diagnosed with Parkinson's.
Try and keep going, I think, and keep doing things that perhaps we wouldn't have done in the past. I mean, my husband hates flying, but recently we managed to persuade him to fly, and we actually went without the car for the first time and had 5 days holiday abroad, and that was for him a first, you know, which he wouldn't have done many years ago.
I certainly don't go hill walking on my own anymore, but I still try to do everything else, go to rugby, play golf occasionally, and generally help about the house, although I just say my wife would disagree.
Life has changed daily because I have to do a lot more of the chores around the house than what I used to. I'm getting better at them now, had a few years practice. And it's the movement that Karen doesn't get when the tablets wear off. And one of the main things is making sure she takes her medication on time.
I wasn't depressed about it, you know. and I take it one day at a time. I have to help him more now to do his buttons and generally whatever I can, you know, and I try to do it in the best of my ability because that's what we're here for. Yeah.
There's not anything that we used to do that we can't do now. We used to walk quite a lot and do 10, 15 miles. Now we might do 2 or 3. We used to cycle ride, we do it much shorter. So at the present time, there's not really anything that we used to do that we can't do now. But that is a concern for the future.
I move around a lot. We go to town center. People always say, we never can find you home, you always seems to be out. But I am making the best of it, you know.
It's all very well saying how important it is to keep a positive outlook, but it's also important to recognise that there will be days when you feel down. Knowing how to manage these times, or to help someone with Parkinson's manage them, is a really important ability. It may be that you need to talk to someone in similar circumstances, which is where the society can be very helpful. Or if you're in a relationship, realising that you're both in this together is a huge step. It's important to realise that depression is a symptom that affects about 60% of people with Parkinson's, and your doctor may prescribe antidepressants, which can be very effective as long as they're compatible with any medication you're taking. Counselling and cognitive therapy can also help. To find a local counsellor, contact the British Association for Counselling and Psychotherapy. As well as your partner or your family, you may also be wondering how friends or work colleagues will deal with your condition. It's not the easiest bit of news to tell people. We can't all be like Nina Temple and hold a party, but the Parkinson's Disease Society does have a leaflet advising how to break the news.
I do find it varies a lot, and I have no idea why. So sometimes I just have to forget about it and say, well, this day is not a good day. Tomorrow, I'll start again.
Well, I'm not always positive. Last year I was very down and I was desperate to meet somebody who was similar age to me and was going through the same sort of situation with family. And I did, through the PDS, I met a lady who was married with children like me and was similar age to me. And we got on well and we supported each other and talked to each other. And more recently I've got involved with the Bristol branch of the PDS and I've met lots of lovely younger people and we can support each other, which helps to keep you positive.
Much as I had this sort of feel of being positive, I still felt that my self-image was, early on anyway, was suffering quite heavily. I used to walk close to walls. And I knew that that was psychologically the wrong thing to do, and I used to force myself into the mainstream stream. So, but having said all that, I did make sure that I retained the spirit of Martin King, and I didn't let this thing dominate my life.
Well, I've come to terms with it now, and I think psychologically I've accepted the fact that I've got Parkinson's disease. And I'm going to make sure it doesn't control me. I live my own life.
Well, like any illness, I mean, you're not on top of the mountain, but in general, it's something that comes to people. And so you just got to make the best of it.
Very often I'm talking to the patient and their partner together, which is the way I prefer to do it. And that's a perfect time to give them permission to talk about anything which they actually want to talk about relating to their relationships.
I don't think that Maureen having Parkinson's affected the relations particularly because we were, or Maureen particularly, was open from the beginning that it was there. So it's gradually evolved that people have just got used to it, and wherever we go, if it's people we know, it's really just accepted. It hasn't caused us any problems really in that respect.
Never been quiet about it. I've told people that I've got PD and they take me as they find me. If they don't like what they see, well, that's not my problem.
Most
most people like to know how to share this information with their family, especially because they've just got the diagnosis. And my advice to them is, firstly, I like to know how they have accepted it before, and or how they feel about sharing that information with their partner, spouse, or their children. Sometimes we encourage them to come to the clinics so that they can all sit together and talk about it. And again, Parkinson's Disease Society has got booklets and information on how to deliver or how to share information with younger family members. For people who live alone, they may have friends or next door neighbors they can talk to about their Parkinson's if they feel they could do that. Otherwise, we do give them booklet from the Parkinson's Disease Society, where they do have helpline. Again, they can utilize those numbers to talk to someone on the phone.
Yes, well, I do tell people my conditions, because many people don't understand, and they'll sort of see you shaking and wanting another and weaken your movement. So I said, well, it's not. I don't go around spreading it the gospel to every Tom, Dick, and Harry, but I do let people know my condition, and they're very good, especially in my church and the area where I live. Everybody's quite helpful or supportive.
Robert Taylor refused to be labelled as someone with Parkinson's. Yet, in coming to terms with his condition, he's enabled other people with Parkinson's to lead a much fuller life.
When I was diagnosed in 1998, on reflection, there were things before that, you know, I was living with a disease, if you like. When we first got the diagnosis, my wife went to the library and she got every book about what might or might not happen. And I thought, well, I don't know what's going to happen tomorrow. You know, why worry about something that might never happen? Or, you know, worry about something that could be 20 years down the line. Just before my diagnosis, I ran a building company and did quite a lot of decorating work. So I had a finger in the art world, if you like. And that's what's really set me on this path, you know, to try and empower people if I can, to show them that it's not the end, you know, it's a new beginning, a blank canvas, if you like. The class has been going best part of 3 years now. We've held art exhibitions and sold paintings, and it's a real collective, you know. The people here really gain something from it. I didn't want to really know the society initially. I didn't want to meet anybody who had this same label. And over time, I've come to grips with that. And I'll have quite a lot of involvement, not only in the arts, but with Parkinson's groups. But I feel that the society is there to help people when they're ready. You know, and it offers that kind of embrace. And I think that's paramount, really. It wasn't so hard telling people. You know, a lot of people maybe cross the street and, you know, they don't want to speak, or they don't have a normal conversation, if you like. You just want to be normal. And, you know, people will come up, how are you? You know, oh, you're looking well. And I always go, well, you look well as well. You know, people find it very difficult to deal with that side of things. I think it's becoming better. There's more awareness now than there was then. In a strange way, it's made me a better person. I don't know if, you know, people can understand that. It's a time when, you know, friends and family, they don't know how to deal with you because they don't know what it is. It's just this horrible thing. And what really did it for me was, after a couple of years, I was starting on another medication that didn't work for me. And in fairness to my wife, I tried it twice, and after 10 days the second time, it took me half an hour to put one sock on. I just went, no, it's not working for me. And that afternoon, some friends of mine were going to play golf, and I went along. I didn't play golf. I walked around with them for about an hour, and they moaned about everything. They moaned about the people in front, the people behind, the grass, the weather, you know, everything in life. And I thought, they look at me as if I've lost something. And it was a big learning for me, because I suddenly realised just how much I've got. And I think that's a big learning for everybody, if you can come to grips with that.
Now you've heard from experts and people with Parkinson's alike, we hope we've managed to answer some of your questions and shown you a bit about the reality of living with Parkinson's. As we said at the beginning, whether you've been recently diagnosed or your partner or someone you care about has, you're not alone, and there's plenty of support. The Parkinson's Disease Society has approximately 300 local branches and support groups throughout the UK, and they provide a valuable source of support, information and contacts. As well as raising awareness of Parkinson's, the Society also raises funds at a local level, and as the Society grows, they're more able to influence change at both the national and local level. By funding research, the Parkinson's Disease Society is always searching for ways to improve the symptoms and quality of life of people with Parkinson's, and eventually find a cure. Work funded by the Society has led to significant advances in our understanding of the condition and the development of a wealth of knowledge and expertise. Studies being invested in cover all aspects of the condition, from genetic and environmental causes to the development of improved drug treatments and complementary therapies. The Parkinson's Disease Society is able to continue and expand its work, activities and support for people affected by Parkinson's only because of the generosity of thousands of people and organisations who give money and time in support of their work. Not surprisingly, people who have personal experience of Parkinson's are often determined to help others who will come after them. I certainly hope you found this film helpful. If you'd like to know more, please call the Parkinson's Disease Society or visit their website, which is full of useful information.